Welcome everyone to the Comfort in Motion virtual presentation. This class is held in person every second Monday of the month at 1:30 in conference room B if you'd rather attend the meeting this way. Otherwise, if you're watching this virtually, enjoy. It'll take me a minute here and I'll get our PowerPoint set up so we can go along with that as well. All right, again, so this is the Comfort in Motion presentation, and you are here because you've decided to have your joint replaced. And my name is Stephanie Edgett. I'm a physical therapist here at Upland Hills Health, and I've been here for about 13 years, so I've seen quite a few hips and knees. And this class was designed for the patient. So please feel free to reach out to physical therapy department or orthopedic department with any questions or concerns that you have. So here's our welcome slide. Imagine what you'll be able to do. So you're here today because you've decided to have your joint replaced, which I can imagine would be exciting and scary all at the same time. But hopefully with time, you'll be able to return to things that the joint pain has stopped you from doing currently. A lot of the times down in physical therapy, we hear that patients, because of their joints, are limited in doing things like hanging out with their grandkids, doing recreational activities like going out hiking, or even biking. So we've put together a team approach to an individualized program just for you. So this is not a set process or schedule like other programs. You are in control. So who is your team? Your team is us down in rehab. It's Dr. Valari, Melissa, nurses, the CNAs, social workers, pharmacy, dietitians. So there's a lot of us that are all here for you. But you've chosen to have your joint replaced. So your hard work and efforts will guide your team forward. So here is the Comfort in Motion timeline. Oops, go back one. So this is basically your total joint process from start to finish. So once you have elected to or decided to have your joint replaced, the recovery coach is activated. And this is an amazing program that has been set up just to be another resource. So it has a lot of information on it, and there are a bunch of surveys attached to it. But this program helps us see what we can do better and helps to prepare you for surgery. So definitely activate that program and stay caught up with it. You'll get emails of different cards to look at and when to look at them. So if you have any questions, again, with that, you can reach out to the orthopedic department or physical therapy. Also on the timeline is a CT. So you'll be getting a CT scan, which is needed to get all the accurate measurements for the Mako robotic arm to assist with surgery. So this needs to be done about 3 weeks before having the surgery. You have the Comfort in Motion presentation, which is right here, done virtually, or you, like I said, you can attend it in person. And again, that is held every second Monday of the month from 1:30 to 3 in conference room B. And I feel this is a great environment for patients to ask questions and be interactive. Other participants attend the class too that will be having surgery. So it's kind of great to meet other people. You'll often then see them when you're down in therapy and in rehab. The next step is a visit with your primary care provider. So this is really important. You'll have a visit with them to basically get cleared for surgery. Make sure you're healthy for surgery. And they'll also discuss your medications and what medications you need to discontinue before surgery and when you can start them after surgery. After that is prehab. And a prehab is an appointment with a physical therapist to review exercises and mobility basically after surgery. So you're gonna bring your walker to this appointment. You can also have your care person with you if you'd like. Your care person can also and is encouraged to go to the Comfort in Motion presentation if you do that in person. But it's also good to have them there for prehab because you're basically learning how you are going to move after surgery. So walking with the walker, how to get in and out of bed, and how to navigate stairs if you need to do that. You have many preoperative appointments. So we'll go through those. One is with the orthopedic clinic. So meeting with Dr. Villari, Melissa, and the nursing staff. And during that appointment, you will receive information on the total joint process, the consent signing. You'll order a walker if you need one. They'll do the MRSA swab and skin prep and educate you on that stuff. This appointment is usually about a week or two before surgery. And you will also meet with a dietitian during this appointment, and you'll be issued supplemental drinks to have before and after surgery. And they'll discuss other things like diet and constipation. And you'll also meet with the pharmacist during this appointment, again, to review any medications and concerns that you have about that. Another preoperative appointment is meeting with the surgical coordinators. And this is usually done via phone call now. And they will discuss, again, things like the total joint process, medications, and skin prep. And this appointment is usually about a week before surgery. Then you have the day of surgery, which surgery usually lasts about 2 to 3 hours. Your hospital stay, and typically patients are being discharged home the next day. So they're staying one night in the hospital. We'll talk a little bit about discharge coming up here. And then rehab. And rehab is usually physical therapy for about 6 weeks. So let's meet your team and talk about that a little bit more in detail. First, of course, we have Dr. Villari. He received his formal training from Rowan University School of Osteopathic Medicine. And then he did his residency at Michigan State University. Some of his hobbies include, he's a foodie, so he likes to bake and cook and visit different restaurants. He also likes home fix-it projects, fast cars, and to travel. So how did Dr. Villar become interested in becoming a surgeon? Well, he comes from a family of doctors. His dad is 80 and still does house calls and rounds. His uncle is a cardiothoracic surgeon. Also, his grandfather was a union pipe fitter, so he started as a young age renovating houses with his grandfather, working with drills, screws, and hammers. And honestly, that's similar to what's done in the OR room. His favorite part of the total joint surgery, taking a patient from the beginning to seeing them at the end when they regain full motion and function and they're pain-free. It's great to see, and that's the goal. His assistant then is Melissa Messer. And her education includes UW-Platteville, where she received her bachelor's degree in biology and her master's degree in physician assistant studies at Midwestern University. Some of her hobbies include spending time with family, going to movies, traveling, home renovation, and woodworking. And her favorite part of total joint surgeries is seeing the final outcome and seeing patients recover from pain. And there is your rehab team. You will not see all of us, and you won't have appointments with all of us, but you'll see a lot of these faces around the wellness center or up in the hospital. So please feel free at any point to reach out to any of them if you have any questions or concerns. We'd all be happy to help. So your comfort and motion guidebook. Recovery Coach is starting to kind of take over the guidebook because Recovery Coach has a lot of the same information. But if you don't have good internet access or are interested in the electronic version, we do have this book available. So I would recommend, again, it has a lot of good information. So you want to bring it with you to your appointments, keep it with you, and refer to it with any questions or concerns. On to frequently asked questions. So this comes from a page in the book, but we'll discuss it a little bit. So what is a total joint replacement? And we'll have a few slides upcoming to discuss that. How long does a total joint replacement surgery last? Surgery lasts usually 2 to 3 hours, depending how things are going. How long before you can return to work? And again, this is kind of dependent on each person and their occupation, but usually about 6 weeks. It can be a little bit shorter if you have a sedentary job and maybe a little bit longer if you're returning to a physical job. How long before I can drive or return to driving? The big thing with that is you have to be off of the narcotic medications, which makes sense. And then after that, left leg, you can usually return a little bit sooner. Right leg is usually about 6 weeks, just because you need to be confident and strong with the movement of moving that right leg for the brake and gas, obviously. And can I put weight on my new knee right after surgery? Absolutely, and it is encouraged. So the Mako robotic arm assisted technology. Dr. Villari will perform the surgery with this robotic arm. The robotic arm will use the measurements gathered from the CT scan to allow Dr. Villari to make precise cuts. So this is basically allows Dr. Villari to pre-plan the surgery before the first cut is even made. And he can use the arm assisted technology to allow for quicker surgery, less blood loss, improve accuracy, and less pain due to less soft tissue damage. So these are the components of the hip that Dr. Villari is using. He is using Stryker components, so you could always Google Stryker and read more in detail about these. So he uses the Accolade 2 femoral hip stem, which you can see there, and then the modular dual mobility socket. So a little bit about this, the stem is wedge shaped to more closely fit a broad range of bone sizes and shapes of today's patient population, and also offers enhanced stability. The socket is designed to minimize the risk of wear, and it offers stability with its large head and low friction design, and it is designed to prevent dislocation. So here is a picture then of the hip progression from the diseased arthritic hip to using the Mako for 3D planning to implementing. So you can see the arthritic hip on the one side and then the total hip replacement on the other side. Your custom hip, Dr. Villari uses a posterior approach. And with that, your incision will be kind of on the back side of your hip. And with that, there are a couple precautions to prevent from dislocation. Out of the 13 years I've been here, I haven't seen any dislocations. I've heard of a few, but none with Dr. Villari. So I don't feel like it occurs very regularly, but it's definitely something that you want to be aware of and not push these things for at least 6 weeks. So the 3 main precautions with this to prevent dislocation, and I've got, or I can describe those here for you quick. But basically, if you're doing something and it feels weird, stop doing it. So the first one is don't bend your hip past 90 degrees. Don't cross your operated leg over your other leg, and don't turn your feet inward or twist at your hip. Or sorry, I said that you shouldn't do these for 6 weeks. So we have these precautions for 3 months. Sorry about that. That wedge pillow that you see in this picture, you want to sleep like that for 6 weeks. So you will be laying on your back, which I know is a little bit uncomfortable for some people, but it's really the best for the hip. Preparing for surgery. So you're going to want to prepare your home and your body. Preparing your home, you're going to want to create a safe environment. So make sure you have all the cords picked up. You don't have any throw rugs that can be caught with the walker. You might want to have some meals that are prepared ahead of time. And then some things to help prepare your body are exercises, and we will go through those in detail in prehab. So those are some exercises that you can start to do before surgery. so that the muscles are getting stronger even before surgery to help the function and outcome after be improved. So the night/day before surgery, no eating or drinking after midnight, but you can drink the supplemental drink as advised by the dietitian. Follow the showering instructions that were given. You can pack an overnight bag, and instructions for an overnight bag are in the book as well as on the recovery coach. Same thing with the exercises, they're in recovery coach as well. And some reminders, make sure you arrive early, so about an hour and a half before surgery. Take only your medications allowed and discussed with your primary care provider or pharmacist. Leave your valuables at home and make sure you remove makeup and nail polish. What to expect the day of surgery. Again, you want to arrive about an hour and a half prior to surgery. The surgery will take 2 to 3 hours. You'll then have time in the recovery room, and then you'll be transferred to your hospital room. And how long you are in the recovery room is kind of dependent on each person. How will I look and feel after surgery? So you will have pain, but your nurse and doctor will do everything they can to help manage this. So you'll get pain medications and IVs during surgery and right after surgery. And then after surgery, when you're up in recovery, they're going to try to wean you off those IVs and start you on pill form of medication. Devices, you will not have a catheter. You'll be asked to empty your bladder prior to surgery. You will have an IV until you're discharged, and a continuous pulse ox, which is a device on your finger that measures the amount of oxygen in your blood. And then covering the incision, you will have a zip line, and you can see the picture there of what it kind of looks like. And the zip line is used to close the incision. It looks like basically little plastic zip ties down the length of the incision. And under that, there are also internal stitches. And then you'll have a bandage over the joint. So the bandage is not waterproof, so you cannot shower for 2 weeks. Instead, you'll be asked to do sponge bathing. But the zip lines are really nice. They have found that they're less painful to apply and remove. You have no skin puncture. You have reduced scarring after and increased motion. And then for assisted devices, you'll want to start out walking with a front-wheeled walker right after surgery. And so you'll need this at the hospital. I still have pain, but it's not the joint pain I had before that I couldn't live with. So we often hear patients say this down in therapy. After surgery, the pain is more of an acute pain or surgical pain and temporary. So it means you're on the road to recovery. Day one, so right the day following surgery, you will meet with Melissa, and she'll kind of check in and see how things are going. Physical therapy and occupational therapy will start. The day of surgery, you'll be getting up with nursing, but the day following surgery, that's when physical therapy and occupational therapy will start, and we'll go into more detail of what they'll do upcoming. You'll be started on oral pain medication and discontinuing the IV pain medication, and then you will have pain medication before the start of therapy. So what is physical therapy? Physical therapists help you return to physical activities like walking, getting in and out of bed, going up and down stairs, and increasing your leg strength and range of motion. You'll be able to put on as much weight as comfortable through your leg, and you'll be walking with a walker or crutches. Most often people are walking with a walker. You'll see the physical therapist 1 or 2 times, depending on how you're doing, before being discharged home. What is occupational therapy? Occupational therapy helps you return to daily activities like getting in and out of the shower, the process of showering, getting dressed, and making meals. Occupational therapy will occur once a day while in the hospital. And Dr. Villari has his patients using a figure-8 compression wrap to the lower leg for swelling. So you can see that compression wrap in this picture here. The occupational therapist will educate patients and caregivers on how to do this wrapping during their session. And then you will wear the wrap every day for 2 weeks. And you can take the wrap off at night and then just wrap it up again during the day. And you will need to have someone do this for you. So this is where your care provider person comes in, and they'll be educated on that. All right, on to the discharge planning. So there are a few different options. Most patients will go home the following day independently or with the assist of family or friends. But if your mobility continues to be significantly limited, you may benefit from some other discharge option if your insurance approves it. Other options include swing bed, going to a rehab center, or home with home health and therapy. So we'll discuss those each in a little bit more detail then. So what is swing bed? Swing bed basically means you get to stay on the inpatient floor with the expectation that you need just a few more days to get stronger before being able to go home then by yourself or with the assistive family. The nursing will no longer be the main caretakers of you, as you can now mostly take care of yourself. And therapy will be the main focus, getting you stronger to go home. So this is only an option to those that qualify, and it has to be approved by your insurance. This can be discussed with your social worker, and the social worker will check with your insurance company on if it's approved or not. While on swing bed, you will continue to see therapy 1 to 2 times a day. So the other option is a rehab center. Going to a rehab center means that you still need a little bit more time before going home. So more like 2 to 3 weeks instead of a couple days before you would get to that independent level of returning home. If there's a particular rehab center you have in mind where you'd like to go for rehab, you can mention it to the social worker, who will check with your insurance company to see, 1, if it's covered, and 2, if you will be accepted. And again, all of that's done by the social worker. And your family often takes you just to the rehab center that you have chosen once you're accepted to this. And then the last option is home care, and this really isn't used very often at all. Again, you must qualify for it. Basically, it means therapy and nursing services are provided in the home. And this is a service you may qualify for depending on your needs and your insurance. You have to be considered homebound. So basically that in order to qualify, it means that it would take you far more effort and exertion in order to get you to therapy, that by the time you arrive to therapy, you'd be too exhausted to participate. So again, this service is rarely used. So again, more often patients are being discharged home alone or with family. So there's a few things you want to remember when caring for yourself. You want to control your pain, so making sure you're taking your pain medications as advised. And I understand some people aren't a big fan of taking pain medications and want to get off of it as soon as possible, but you do need to be able to function and move and do your exercises. So you might still need to take some medications to be able to do those things. You're going to want to expect body changes. You might leave the hospital and not have that much bruising and swelling, but over the next few days have a lot more bruising or some more swelling. So expect that to happen, but definitely reach out if you have any concerns about this, again, to the therapist or the orthopedic department. You're going to want to continue with the wrapping as advised by the occupational therapist. You're going to want to take your blood thinners as advised. And you're going to want to be cautious and careful in the kitchen and bathroom. Again, make sure that everything's prepared and the throw rugs are put away. And the bathroom, they'll talk about in prehab. If you're having a hip, you might want to have a riser in the bathroom or a reacher that you can use throughout the day. And we can talk about those when you're in prehab. Preventing falls. So absolutely no falls after a total hip or total knee. And then caring for your incision. Again, you don't want to get the incision wet for 2 weeks. You'll have to do some sponge bathing. Outpatient physical therapy. This is where the fun starts. And maybe we think that just because we're in the therapy department. But this is where your hard work pays off. Therapy will be 2 to 3 times a week for about 45 minutes. You'll probably attend therapy for about 6 weeks, depending on your progress. You'll need someone to bring you to therapy, as you cannot drive for at least 4 weeks or while you're on pain medications. Therapy 2 to 3 times a week is definitely not enough. You'll be given exercises to do at home, and it's very important to do these exercises daily. This is a picture of our wellness center. We're very lucky to have this beautiful wellness center with lots of lovely equipment, but you don't need all of that equipment to recover from a total joint surgery. Your therapist will give you plenty of things to do without the machines. Also, we have a post-therapy wellness center membership. So once you're done with therapy, you could look into that to continue doing therapy once you're discharged. You could do your own. And should you buy exercise equipment? You don't need to. People ask me if they wanted to buy something, what would we recommend? And I think a recumbent bike is a nice option for total joints, just because you're not on the joint and it's a good way to keep the joint moving and blood pumping. So tips, tricks, and words of advice. Work hard every day. Stay on top of your pain. So ice, ice, ice. Take your pain medications as advised. Elevate, and elevate doesn't mean sitting back in the recliner with your legs kicked up. It means laying flat on the bed with your legs above your heart. So that will help with the swelling and pain. Communicate, so make sure you communicate with your therapist and orthopedic department on any questions you have, and keep up with the recovery coach or having your guidebook with you, as I have a lot of answers in it. There's some of the resources, like we talked about. Dr. Villara uses Stryker, so you could always Google them if you have any questions. There's ME videos available on Recovery Coach, or there's an address for those. And the Mako robotic arm, there's information on that as well. So thank you so much for listening to the virtual presentation of Comfort in Motion. Please feel free to reach out if you have any questions or concerns.